Normal skin pH is slightly acidic, which helps maintain the skin barrier and fight microbes. People with eczema often have a higher or more alkaline skin pH, which allows bacteria like Staphylococcus aureus to flourish and worsen inflammation. Emerging treatments aim to restore skin acidity, such as acidic creams or pH-balancing cleansers. Research suggests a link between gut bacteria imbalance and eczema flares. Some small studies show that probiotics may help prevent eczema in infants or reduce severity. Trials are ongoing to see if fecal microbiota transplants could benefit severe or treatment-resistant cases. Biological treatment called Dupilumab has revolutionized treatment for moderate to severe eczema. Pipeline biologics aim to reduce itch, inflammation, and flares with fewer side effects than steroids or immunosuppressants. Many eczema patients have a mutation in the filaggrin gene, which weakens the skin barrier. This mutation also increases the risk of food allergies and asthma later in life, a concept known as the atopic march. New gene therapies and barrier repair molecules are being developed to compensate for this genetic weakness. Beyond itching, eczema is also linked to sleep disruption, which in turn increases anxiety and depression risk. Brain imaging studies suggest that chronic itch activates the same brain centers as chronic pain, which explains the emotional burden. Future treatments may focus on this aspect of eczema.